Julia Butcher has been a nurse here for 7 years. She works at the F2 intensive care unit at Berlin's UKB Trauma Center. Instead of treating accident victims, her station is filled exclusively with COVID-19 patients. And each time, she puts on a protective suit, gloves, and so on. The works. Treating coronavirus patients is especially challenging and stressful, both physically and mentally. I have to be proactive with the patient. And sometimes I also say, I don't know if we'll see each other again. These are things that you take home with you. You can't just work 8 hours and then go home and shut off. Now, during the coronavirus pandemic, you're permanently confronted with it, also privately, and you take some of it home with you. Frustration at the unit is rising among both nurses and doctors. Almost none of the severely ill patients have been vaccinated. We're seeing that 20% of our intensive care capacity is occupied by patients who, for the most part, wouldn't be here if they had been vaccinated. It's frustrating. About 5,000 COVID-19 patients are being treated in Germany's intensive care units right now. That means about every 5th ICU bed is occupied by a coronavirus patient. And as a result, planned operations must be postponed. Senior physician Hans-Joachim Janssen is convinced that without a vaccine mandate, as the government is currently discussing, the problem cannot be tackled. There is simply a difference between having a vaccination rate of about 70% or one of more than 85%. It has a massive effect on infection activity, and getting to that point is very difficult. We won't make it otherwise this winter. It would affect us again next summer and autumn. That's why I'm for a vaccine mandate. Every COVID patient receives these medications, and more, every day. Those who don't want to get vaccinated say these medical professionals should keep that reality in mind.